Maria Holder Diabetes Center.
The only difference between a glass of orange juice and a glass of Coke is that the orange juice has some vitamin C in it.
It's another June Saturday morning on VOB 92.9 FM, and it's time for 15 diabetic-friendly minutes, all with the compliments of the Barbados Diabetes Foundation. And you listening to VOB, know it's June, you're hearing crop over music, but you know what else is special about the month of June? I would like to know. Let's hear the answer from Dr. D.
We're in the month of June, and this is Men's Month.
June is Men's Health Month, and we have another special show for men coming up today. So let's see what Dr. Diane Braffett has in store for men in today's show.
You don't have to be elderly, of course, if you're living with diabetes or some other NCD to have erectile dysfunction.
Are you up to hearing some more about erectile dysfunction? Dr. D and Dr. Singh tackles this pernicious topic. All this and more coming up with the compliments of the Maria Holder Diabetes Center, the Barbados Diabetic Eye Screening Program, and the bank that if you have a financial dream can help you achieve it, whether you're a man or a woman. Republic Bank.
Dream a dream and watch it become a reality. You can do anything. Pull up a chair, come sit and come share with Republic Bank. You can do anything. Yes, we're the one for you, making dreams come true. We're the one for you, your partner for life. We're the one for you, Republic Bank.
In 2026, for podiatry, diabetic eye screening, and vascular services, the Maria Holder Diabetes Center is your #1 choice for the best diabetic services at the best price. If you are diabetic or pre-diabetic, or would just like to get your numbers checked, diabetes doctors, nurses, a dietitian, and a range of health professionals are available to serve you. Just call 417-0305 for the Maria Holder Diabetes Center located in Warren St. Michael, saving your life and saving you money. But members get 10% off.
Good Saturday morning, VOBers. This is Peter Boyce here. How are you doing today? You all already hear how June is Men's Health Month, but you know what else is special about tomorrow? Tell them, Dr. D.
Father's Day is coming up.
It's Father's Day! Father's Day! Father's Day! So did you buy anything for your daddy yet? If your daddy is diabetic or pre-diabetic, the Maria Holder Diabetes Center, located in Warren St. Michael, might be a good place to take him next week as a special health treat. Get him a vascular screening or an eye screening for diabetic retinopathy, something that he should be doing every year if he's diabetic, or an appointment with dietitian Victoria Cox to check up on how he can improve his eating habits, stop drinking so much sweet drinks, or make an appointment and get a checkup with Dr. Diane Braffett to see how your dad's health is. Even if he is not diabetic, you can make an appointment with the Maria Holder Diabetes Center. Believe it or not, all these things can be done under one roof.
243-3937, the Maria Holder Diabetes Center.
We promise you a men's topic this morning, so we're going into it now. So let's hear from Dr. D and Dr. Singh.
Hello, good day to everyone out there. Not forgetting that we're in the month of June, and this is Men's Month. And I'm here again with Dr. Singh, and we're going to continue our conversation from last week. Hi, Dr. Singh, how are you doing?
Hi, I'm doing good.
I think when we're dealing with diabetes, I think we get a mixture of metabolic and psychological. And then, of course, I think as well, you don't have to be elderly, of course, if you're living with diabetes or some other NCD to have erectile dysfunction, because the problem with the blood sugars, can contribute to it. I was asking you earlier about the link between sexual function and general, what I call circulation or vascular health. Can you just share a little bit about that and why it's so important to address erectile dysfunction versus just thinking about how you're performing forming.
Right. So, as we know that erectile dysfunction is very, very closely related to diabetes, because diabetes also is a problem of, circulation, like the peripheral blood vessels, that is the small blood vessels which are damaged in diabetes. So, similarly, just like the peripheral blood vessels, as I said, are very small, even the blood vessels in the penis, these are very narrow and small blood vessels. So, it's just like a plumbing issue, right? So, when you have your diabetes which is not under control, so your blood sugar levels goes high, and because of that what happens is just like a pipe getting rusted, right? So what will happen to the rest or the sugar levels, they will cause damage to the wall, and there will be increased levels or deposition of fat. So as a result, poor flow will be there, and there will be narrowing of the blood vessel wall, and as a result definitely this circulation problem would result in difficulty in maintaining or initiating an erection.
Right, and also I think it's just that I always tell people that sugar doesn't just affect one part of your body. So if it's blocking up the circulation in the sexual organs, it's probably going to be an indication that it's starting to interfere with the circulation in the feet, in the heart, and in the brain as well. So it's actually early marker that you may have heart disease and that kind of stuff. Yeah, and tell us a little bit more about the available treatments for sexual function, or what tests are done.
Right.
If a male says, well, doc, I'm having a problem with sexual function, what kind of tests can he expect to have done other than the history, and what kind of treatments are currently available in Barbados?
Right. So we also have, when you go to the doctor, he would also, to a specialist, if you go and present to a specialist, they would also do a Doppler ultrasound to see the circulation, whether it is proper in your, reproductive organs, in your penis, right? So that can detect, and also it is important, as I said, especially in our setup, very, very important to check whether you are having any kind of chronic illness. So always have a good check with your blood pressure, look that your blood pressure is normal, that again, no circulatory problems are there, and then you should screen for your blood sugar levels, always get your HbA1c levels checked, and also the blood cholesterol levels, to see that you're not having any kind of, heart disease. Look at your, different types of cholesterol, the LDL, HDL, everything, get it screened properly.
Okay, of course. And then in diabetes, sometimes we will recommend that males may have their hormone levels checked.
Yes.
Especially testosterone early in the morning, because high sugars can actually interfere with the testosterone production. Yes. But thanks for that information on the ultrasound of the penis. But as you said, that's done by a specialist, not here at the center. That's more under the area of like a urologist or something like that.
Definitely.
Right. And how is erectile dysfunction treated? Are the treatments safe? Is it safe for everybody? Is there anything that you need to look at before you put people on the medication?
Right. So it's very, very important to know that what are the different modalities. The most common modality what we have for treatment currently is the PDE5 inhibitors, which is the phosphodiesterase enzyme inhibitors. As we know that nitrous oxide is very, very important for maintaining an erection, and the friend for nitrous oxide is an enzyme which is known as cyclic GMP.
Wow, that sounds complex.
No, let's just keep it simple.
Let's keep it simple.
Right. So sorry, the enzyme which is the PDE5 inhibitor, that is the main enemy of erection, right? So we have our fighter, which is the medication which we give, which is the PDE5 inhibitor. So that inhibits that enzyme, it fights that enzyme. So what does it do? So it promotes relaxation of the blood vessels, because we know for erection, what is happening during erection is the blood vessels, the smooth muscles which are there, they relax, and the blood flow goes and increases and fills those blood vessels, which leads to engorgement and erection.
And so some of these things will be things like Viagra.
They are the PDE5 inhibitors.
Okay, so they open up the blood flow to the penis, so you can still get things going on down there.
It's important to always have a check when the doctor is prescribing. They will ask you about whether you have any kind of cardiac illness, heart disease, are you suffering suffering from any heart disease problem, are you hypertensive, because it's always, there can be side effects in this patient. The blood pressure can suddenly go down, and always they ask you, whether to take it 2 hours before planning your sexual activity, and to avoid grapefruit, especially grapefruit can have a, reaction with this medication. So we always ask the patients to avoid such things before.
Okay, well, thanks for that, because I know on the black markets, you can get some of these medications, and sometimes people might be taking them without having any screening for, things that maybe would be a contraindication to use them. So, we just want everybody out there to make sure that if you're going to use them, you're using them safely, and that you're not at risk of any side effects. And then there's some things that I hear patients tell me, oh, this is natural, but then when you look, it's not really natural. It's actually having active chemical components that can still have, side effects, even if it does maybe have some effects. So just be careful with what you're using out there.
As we go from Dr. D and Dr. Singh into our Saturday song of the day, some people are saying this is an appropriate dysfunctional song about a man who had a problem playing a game of cricket with Jill. This is the mighty Gabby, Dr. Anthony Gabby Carter with Hit It. Compliments the Maria Holder Diabetes Center and Republic Bank.
Jill was playing cricket with me on a pasta one day. She bowling like sobas and I couldn't get the ball played.
This is my problem. I'm not able to satisfy my partner.
She start with in and out swingers that puzzle me. Every time that I make a stroke, I missing she pull it slow. I on my toe to Mr. She. But when I play for a break, it was Boogali. She tell me, hey, how you missing so? You used to brag before. If you could handle me, hit it and let me see. Hit it in the corner, hit it in the cover, hit it in mid-wicket.
The Maria Holder Diabetes Center.
Another service which is available at the Maria Holder Diabetes Center is vascular or ABI screening. Let's hear what vascular sportsman Donald Clark had to say about this.
I should indicate that this is not a male-only condition because of erectile dysfunction, but female condition as well. Ladies with varicose veins have their condition to have this ailment. So I would want to say that women should also have this test done. Again, peripheral artery and peripheral vascular, which is different because arteries are arteries and veins are veins, but varicose veins is a telltale sign that there's a problem with peripheral vascular disease. In men, of course, it's erectile dysfunction. That is major. That's how you tell that there's a problem. That's how men would normally tell that there's something going on, there's no blood flow, or there's, I should say, reduced blood flow to the penis, of course. But in women, varicose veins is a telltale sign that there's also a problem. Peripheral artery disease, it's a simple test. It's called an ABI test, and I can't stress enough the importance of getting this test done.
Cutting-edge international medical services are waiting for you at the Maria Holder Diabetes Center. If you are listening to VOB right now and you are diabetic or pre-diabetic, vascular screening, diabetic eye screening, dietitian consultation, and podiatry services can all be accessed by calling 417-0305. Make that call today. The last 15 minutes you heard on VOB was brought to you with the compliments of the Barbados Diabetic Eye Screening Program, the Maria Holder Diabetes Center, and Republic Bank. Until next time.
Remember, diabetes isn't just about sugar. It affects your heart, kidneys, eyes, and mind.
Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 243-3937.
Dream a dream and watch it become a reality. You can do anything. Pull up a chair, come sit and come share with Republic.
Holder Diabetes Center.